it. All right, so we are live. Good morning, good afternoon, and good evening. Welcome to the Wild and Precious Optimal Living Show. I am your host, Dr. Sam McDonald, with my co-pilot,
Dr. Lynn.
Thank you all for tuning in today. We've got a fantastic guest today. I'm really excited for him to be on because this guy, man, I mean, we only got to talk for a few minutes earlier this week, but he comes highly regarded from a lot of people that I trust dearly, and man, talking to him, he is ultra smart. So we are the Wild and Precious Optimal Living Show. We are a show who loves life and who also is constantly talking about increasing the resilience in brain, body, and emotion. So wherever you are, we're here to share with you the latest tools and technologies to help you live the healthiest life that you possibly can. And it's like I said, today we've got Dr. Michael Trayford from Apex Brain Centers out of Asheville, North Carolina. He is the founder and director, and fun fact, he also works with his wife.
Yeah, after all these years, yes.
So Dr. Michael, welcome to the show, and tell us a little bit about yourself and a little bit about Apex Brain Centers.
Well, thank you all so much for having me, and thank you for doing what you do, spreading the good word. About myself, I'm not, I don't like talking about myself too much, but founder and director of operations at Apex Brain Centers. We've been doing that model for about 8 years, and I'm in practice for just over 20 years. Hard to believe. My goodness, 20 years goes by fast. So originally from New York and made my way down to the mountains of Asheville, North Carolina for many reasons, mostly quality of life issues. And never look back, just absolutely love it here. It's a kind of a hotbed of progressive healthcare, in addition to having a lot of great mainstream healthcare options. So it was a perfect place to be, even though we see people from all around the country and some coming from other areas abroad. It's just nice to have this base in the mountains where people just love to come to. And I just am thankful every day to wake up and be here in these mountains. So Apex Brain Centers, we have a largely intensive model. That's what we do. We see people for 1 or 2 or 3 weeks in the areas of brain injury and adults with learning behavioral issues with an emphasis on addiction, and then cross over into cognitive impairment. And that's our sweet spot. So we really like working in that space, and that's what keeps us busy.
Wow. Well, first of all, to be able to handle those 3 major issues with people, for one, is definitely put you in the top tier, but then to do that in a model where you're seeing people from 1 to 3 weeks, I mean, that's a special thing. So that's cool, and that's why, folks, we got him on today, because like I said, this is a guy who one, definitely thinks differently, but also is thinking far ahead than mainstream medicine. So before we dive into our talk today, first of all, we want to give a shout out to our sponsor, Shed Light Cold Lasers. So if you are a doc on the market looking for a cold laser product, or if you are a person who is struggling with a chronic or complex issue, then we invite you to check out the Shed Light Cold Laser and the Shed Light Cold Laser group. These are some of the best products in the market. Again, Dr. Lynn and I use this thing, I mean, every day. We're using it every day in practice. We take it home and use it every day at home. It's just been something that's literally been a life-changing piece of technology for us. And the mentorship behind it, the group that has developed this thing, I mean, second to none. And I just love them like family.
Yeah, That's awesome. Yes, I can't agree more. It's just the support from Dr. Damien, especially. A shout out to him and how he supported us, and how he connected us too with Dr. Trayford. So absolutely. And for mindset today, for our listeners, something to keep in mind. It's a Friday. And I want you to I know that, right now, political season feels heavy. Let's talk about flu season and COVID, not to mention all those things, right? And it comes back down to, how are you taking responsibility for your own health? Because it feels like when we think about these challenges in terms of our health, and we can listen to the news, and it can be quite scary. The biggest thing for you is to be able to make sure that you're taking care of yourself, your family's taking good care of themselves as well too. And you have kids, it's about having them watch you, having them model what you're doing as well too. Our mentor, Dr. Robert Malilo, he talks about, if you want your kids to be healthy, you have to look back at yourself and ask yourself, are you doing the same for yourself? So that means turning to good nourishing foods, turning to movement, and what type of movements that actually can be playful as well too, like going to the park and creating recess time between you and your kids, and it doesn't have to be just during the day. It could be at the end of the day. Get some fresh air. And the other aspect is also, as chiropractors, check in with a chiropractic office as well too, because that's the best way to be able to see how your nervous system is thriving as well too. And chiropractors have a different approach in looking at your whole body. And so getting consistent care through chiropractic, through nourishment and movement. Anything else, Dr. Sam?
Yeah, I mean, definitely then just adding in, making sure you're getting necessary, vitamins and supplementation too, because you need the fuel to run the whole system.
Yep.
And that's a super, super important thing, especially as we move into, more sedentary time of year when we're indoors because the weather gets cold, except for Colorado, then everybody's going out to ski in the mountains. But,
yeah.
We've got to make sure that you're getting the necessary fuel to run the body too. Absolutely.
And Dr. Trayford, do you have anything to add to that as well?
That was great. I like to take the bird's eye view approach. We talk about, I'm actually in the process of writing a book we may have time to talk about later for the addictions recovery community, and that's obviously an area that's been so challenged by this quarantine, by this pandemic. But really looking at the basic tenets of, eating right, sleeping right, moving right, thinking right, just getting people to think along those lines. You go down any one avenue, just eating right or just sleeping better, you're going to do well. But if you can address those 4 areas, that's really where it's at. So people need to take care of themselves now more than ever. And like you touched on, modeling for the next generation, modeling for the kids. We do that every day with our kids, and you can't do enough of that.
Right.
Definitely not.
Absolutely.
Yeah, as a parent, it's always fun seeing your kid reflect back the stuff that you don't even realize that you do, and it's like, oh wow, really?
Right.
And take responsibility for my stuff because don't want to pass this on to the kiddos.
Yeah, absolutely.
Right.
Yeah.
Cool.
I always say when we're in the supermarket and there's all the candy and everything as you're checking out, and our kids don't even bat an eye and look at that stuff just because we, that's one area I think we did a real good job. So that's that's where we get a smile every time we go shopping.
There we go.
Right.
Yeah.
Absolutely.
We were joking the other night, and he wasn't eating the rest of his dinner, but our kiddo was more than happy to eat the entire bowl of broccoli. So it's like, well,
there you go.
Not gonna be mad about that.
That's good.
Kiddo.
Parenting wins. Yes.
Exactly. Take them when you can.
Yeah.
Awesome.
Yeah.
So let's dive in. Let's talk about you. Let's talk about your practice. And you were brought to our attention by, again, Dr. Damien, and kind of known throughout the functional neurology world as being the guy who's really the expert in neurofeedback and KUHS and this model. So for our audience out there, can you explain what neurofeedback is and what is KUHS?
Yeah, absolutely. Neurofeedback takes different names. Neurobiofeedback is kind of the overarching category, which kind of explains what it does, and I'll get into that in a minute. But neurotherapy, I like EEG-directed biofeedback. That's really a very appropriate description because you're using tools, you're using instrumentation and equipment to feed back to an individual indications of what's happening in their brain. So it's largely getting an individual to regulate their own brainwave activity through sight, through sound, so visual, through auditory types of feedback, and clearly very complex when you're getting into the different types of brainwaves and the different types of conditions and all of these things that come about. But essentially brainwave optimization, you're getting people to understand how to learn how to control their brainwave activity, just like if they were doing any kind of biofeedback, trying to make a muscle, looser by kind of thinking about it, or doing things, that a surface EMG unit could show you that muscle is actually getting looser. Well, here you see and hear things that tells you you're getting more alpha brainwave activity if you happen to be deficient in that. The key, I believe, being at this for so long now, is having the roadmap. A lot of people go blindly into neurofeedback, and I think probably, doing some is better than none, but having a plan, having a map, having a guide, just like anything else in the functional neurology world, is incredibly important for people to understand, and that's the QEEG component of it, and we can certainly get into that in a bit.
Awesome. So how did you get into neurofeedback? Because it's been around for a long time, and there's been a lot of discussion on, hey, does this work? Does it not work? I know that's one of the most popularly searched items about neurofeedback. So how did you end up, getting into this field?
To me, it was just one of these epiphanies. I said, my goodness, I've been treating the brain for 10 years, and while I understood basics about EEG, from a, we used to see a lot of seizure disorders, and we still do, especially as related to traumatic brain injury. But, why aren't we as functional neurologists looking at electrical output of the brain? It's an incredible marker. Even if we're just looking at that and, maybe not even doing neurofeedback, it's an incredibly valuable tool that can teach us a lot about one's brain. But now we have the tools like neurofeedback and even transcranial pulsed electromagnetic frequency, even other aspects of biofeedback that we can do concurrent with the EEG to make massive changes. So, I'm a science guy, and I need proof, and I need backing, and I had to really cross over into the psychology world. I'm not a mental health provider. I'm not a psychologist. But I started spending a lot of time in that world and a lot of time with those individuals, and they taught me a lot, and they taught me a lot about what I didn't know that I should know. So it really was, for me, it was a have to. I had to know how to read brainwave activity and do something to augment it should there be challenges that we understand relate to certain conditions.
Wow. Okay, very cool. So then getting into that, you're needing a roadmap to, like I said, see where you're going. That's where the KUHS comes in. So describe a little bit about for the audience what that process looks like, how you're able to map the brain, and even reading on your website and doing some research on you guys have an even more advanced technology where you're getting almost a 3D image of the brain.
Yeah, absolutely. The scope has expanded tremendously. Even what we can measure in the brain as far as electrical output is now, for those who aren't aware, the cortex or outer covering of the brain is the electrically active part. And that's where the measurements come from. But now we're actually able to surmise what's going on below the surface of the cortex in really important areas that we deal with all the time. But taking it back to the KUHS, so KUHS or quantitative EEG is essentially raw EEG data. So just like an EKG, you hook up electrodes to the heart, you get all these little graphs of what's happening. Same thing with the brain. We get the same types of graphs, but now we can take this data and compare it to I don't like the word normative so much, but average databases, just like lab work. You have blood sugar should be from here to here. Right. So we have understandings of certain brain waves where those, where the quantity of those brain waves should lie in an 18-year-old boy, in a 60-year-old female, in somebody with a brain injury. So we have all these normative values we can compare raw data to, and we get an understanding of where things are too high, where they're too low, what part of the brain, what particular brain wave. The metrics explode. I mean, with the equipment we have available to us now, we can look at thousands and thousands of metrics simultaneously, and it's really, it's quite intimidating to do so, and maybe that's what keeps some people from getting into it, because it's a life's work. You can't learn this stuff overnight. But there are enough people out there, enough mentors and references and resources that can help people get started. You have to start somewhere. And for many people, that may just be recording from one part on the brain, getting that data, comparing it. But then we get into now looking at multiple areas on the brain. So the typical quantitative EEG is 19 channels. We measure from 19 channels, and then we take that data, compare it to the normative databases, then we get the flat kind of paper brain maps. Beyond that now, Loretta imaging, which is low resolution tomography, similar to kind of like a CAT scan. Different images are taken and put together to get a three-dimensional image. So now we can get real-time three-dimensional electrical imaging of the brain that, again, is not only the cortex or outer covering, but it's the lower aspects. And they're even doing imaging on the cerebellum now, which was unheard of 5 years ago. So it just keeps growing by the day. I can't keep up, but I'm determined to keep up as best I can.
Is this something that neuroscientists are using in the research world as well too, to understand? Because I was just talking to a colleague right outside before we started the show who had interviewed someone like Dr. Bessel van der Kolk, and how he studied trauma and how that changes the wirings of the brain. And so is that something that, how is this utilized in maybe the research world for us, to, even as functional neurologists, to better understand how to take care of people?
It's tremendous. I could look at these things all day, and the fact is you have technology now that is approaching the level of something like functional MRI or SPECT scan without the tremendous cost.
Yeah.
Now, granted, if you want good equipment, it's not cheap, but it's certainly not comparable to what you're going to pay for. Not everybody has a functional MRI unit in their office. They can, get people in and look at these things. So, the data, the literature is getting very rich with quantitative EEG and S-Loretta imaging-based studies because it's accessible to the average practitioner, to any clinic, and particularly with research budgets in major universities being just squashed and cut, they need less expensive tools to be able to provide similar or same types of data. So, we're taking this information every day and using it as best we can to help drive clinical outcomes. But by the same token, we're also taking it and crunching the numbers and developing our own kind of internal databases for which to compare to. So our own, in-house research, and we have full intentions of working with some of the universities here in Western North Carolina to really sift through the data and start to create literature of our own.
Yeah. Is this something too that you can utilize as not just collecting data, but to also treat at live too as you're measuring? Is there something that's incorporated with training as well too, like as they're doing it?
Yeah, there is. There's a lot of differences. Neurofeedback, it's kind of like chiropractic or psychology. There's so many different techniques and approaches to things.
Yeah.
Neurofeedback has many different camps, but and there's a lot of the purists that go back to single site training. If you have too much beta in the right front part of your brain, that's what you're going to do is train down the beta in that right front part of the brain. That's old school neurofeedback, which still is very popular, very effective. We do that in addition to more of the newer technologies where you're actually training real time to the databases. So you can have 19 channels of information coming through, running through the databases while you're starting to pick which parts of the brain you want to, work on, so to speak. It's called, it's basically Z-score training. You're training to the databases and you're looking how far from the database averages in terms of standard deviations or Z-scores. I know we're getting a little bit up in the kind of talking about this, but the further you get from the norm, the higher or lower the Z-scores. And we want to bring those closer to the norms in most people. There are outliers that we have to understand are always going to be way out of the database, but we can train real time with what's called region of interest training. So as you're in the middle of a session, you start seeing something going on, you're working on that right front brain. You see something going on now in, say, the cingulate gyrus in the middle of the brain, you can now shift gears and go right to that cingulate gyrus rather than going out and creating a whole new program. So it's a lot of on-the-fly adaptation, manipulation of data, and it's much, much more convenient once you can, get to that level where you can feel confident just kind of moving from one thing to the next and not just picking one protocol and doing that for 5 or 6 or 10 weeks.
I see. And that's probably, I imagine, how you are able to do more intensives and compress a lot of people's results within a few weeks versus... Yeah,
and absolutely. From purely, intensives involves all of the functional neurological applications, so laser therapies, balance and vestibular rehabilitation, eye movement therapies, metabolic therapies. But one thing we've done, which, was and is still kind of frowned upon in the neurofeedback world, is this concept of intensive neurofeedback. There's a lot of people that say you can't do that and shouldn't do that, but the fact is we've been doing it now for about 8 years and seeing great results, and I think it's because we have a lot of adjunctive modalities to help facilitate the recovery process from neurofeedback sessions to augment and support metabolically, so people can simply tolerate higher levels or higher frequencies of stimulation. But it's not uncommon for us to do 2 sessions a day, 5 days a week, just neurofeedback alone with people.
Goodness, yeah, that's a lot. Especially, I've done a little bit of a neurofeedback in another office, and it was more of that traditional model. It was a 2-lead model, and you're putting some people on there for 20, 25 minutes at a time for 8, 10, 12 weeks, and seeing maybe, some percent change, like 5 to 10% change sometimes, if we were lucky. And the fact that you're getting that kind of massive change in 3 weeks is incredible. Which I'd love to kind of know, what is it that you're doing to support? Because I saw on your site you mentioned some PEMF therapy and obviously the laser therapy as well. So what else are you doing to be able to support that recovery process so people aren't just totally wiped?
Yeah, absolutely. It's, number one, there's also the types of protocols you choose.
Mm-hmm.
So, for example, the single site training you were talking about, or two site training,
Mm-hmm.
those classically have been more fatigable types of protocols. So when we get into those protocols, we may do them once a day or once every other day.
Mm-hmm.
With the Z-score training, the live S-Loretta training, where you're working the whole brain, believe it or not, working the whole brain is less fatigable than working a single site.
Mm-hmm.
It's kind of like, working out with weights. If you're doing like hyper concentrated bicep curls, that bicep is going to fatigue much faster than if you were doing kind of whole body exercises that involve the biceps, right?
Mm-hmm.
So, we're picking modalities that people will tolerate more efficiently so that we can do more of it and just respect neuroplasticity and allow for learning to occur much faster. And then we can go to the more, quote unquote, aggressive protocols as needed.
Mm-hmm.
But as far as supporting, the laser has been tremendous in terms of, cold laser, low level laser has been tremendous in allowing people to tolerate more stimulation. Nutritionally, clearly getting into appropriate types of, magnesium, essential fatty acids, depending on what their scenarios are, looking at even, GABA stimulants for, folks with high anxiety, even getting into brain injury with muscle spasticity. So there's lots to do on that metabolic end. But as we begin to create neurological efficiencies, whether it's through balanced systems or visual systems, people don't burn through as much fuel. I mean, that's what you all see in practice, and any other functional neurologists would attest to that, the more efficiencies you create, the more people can tolerate. Mm-hmm. So I think the coupling of the neurofeedback with all of the other modalities is what allows it to be more effective.
Mm-hmm. Yeah.
That's awesome stuff. Wow. So someone comes into your office, what, like you mentioned addiction, traumatic brain injury. I know there's cognitive decline as well. So someone comes in, what's the typical process? How do you start with somebody, and then where do you go from there to get them to this point to start training, to start turning their life around?
Yeah, it all starts with conversation. We always talk with people first, because we are very selective in the types of cases we admit. Not because we're selective or we just want to make sure that we're serving the people that we serve best. And it starts with the conversation. We get calls from all over the place, so we have to sit down with people on the phone. Usually we do 10-15 minute free consultations just to see if they're a fit for what we're doing. Once we determine that, then it goes into, if they're within a 3, 4, 5 hour driving distance, many people will come in for a full day, what we call a day of discovery. So it's about 5 hours worth of testing, including EEG, testing of eye movements, balance. Cognitive testing is critically important. We do lots of that. So the physical markers, the cognitive markers, the metabolic markers, we got to put all that together, and then we determine what program people fall into. Now, naturally, some people are coming from greater distances, and they have to come, dovetail right into a program where all the testing is done up front. But we've, at this point in time, we've been doing this long enough that we can get a good sense of it, if it's going to be, a week or 2 or 3. The average week that we spend with somebody entails about 12 to 15 hours of one-on-one rehabilitation. So, when you pack that many hours, 15, 30, 45 hours within 1 to 3 weeks, we can get a lot done. But the process is that it always starts with the conversation, then the diagnostic testing, and then we jump right into the treatment modalities that are largely dictated by what we're finding on examination.
Wow. That's a very different model from, we're 4 years into practice, and it's always so fun to be able to hear like how, where it could be taken to practice-wise, and just the things that, they approach in taking care of people. In school they teach us it's this length of a care plan, but there's so many different ways in doing it, so it's impressive.
It was out of necessity for me because, frankly, I did the kind of family practice thing for a long time, but there was always an anxiety in me that when I was treating somebody for extended periods of time, and I believe fully in maintenance care and people, taking care of themselves for the long term, but personally for me, I needed to kind of get in and get out. Mm-hmm. And I just was uncomfortable treating people for long periods of time. So we do the work we do, and then we try to empower them with whatever they need in terms of tools for home use, be it lasers or vibration plates or you name it, metabolic therapies, etc., hooking them up with practitioners in their area that can work the maintenance side of things, but you know, it was a bit anxiety provoking for me to you know, be seeing the same people all the time, and this model really was a necessity for me, and it turned out to be the best thing for what we're doing.
Yeah, that's incredible. I mean, especially like Dr. Lynn was saying, I mean, just I think what is most commonly practiced out there now and the results that people are getting, and you know, they're delivering excellent help, and it's amazing, but just also just seeing, you know, like yourself, you've been doing functional neurology now for almost 20 years, and
yeah, a little bit over. I think I keep trying to keep it under 20 years so I don't feel so old, but I think it's actually over 20 years now.
Yeah, but just seeing the mastery that you have of that, and then again, just how someone's life can be transformed, honestly, in I mean, 1 to 3 weeks is literally, it's mind blowing.
Yeah.
And the fact, especially, this isn't easy stuff. I mean, traumatic brain injury and addiction and cognitive decline and these kind of things. It's not easy. It perplexes most doctors out there. Wow.
And it also it requires a certain type of patient as well, because this is why we have the screening process, because, you know, as we know, there are certain people that want to push through any barrier so they can kind of get back to their life at the highest level possible. And then there's other people that, you know, they like going to the office on a regular basis and, you know, having that, you know, that thing to fall back on, whatever it might be, you know, and I completely, you know, respect that, and people need ongoing care. But I just felt, and I was tracking over time, that our effectiveness was waning the longer we were seeing somebody. So that's kind of why we get in and get out, and then just kind of set people up for success after the fact. I tell people all the time, we're foundation builders. We don't build the house. You know, we build the foundation, and then they can put whatever kind of house they want on top of that.
That's a good way to put it.
I like that.
Yeah. That kind of ties into my curiosity behind you working with addictions, because I imagine working with people who struggle with addictions, is it a particular population? Is it through drugs, or is it with people who struggle with drugs, gambling? What type of addiction specifically are you working with that people are struggling with?
Yeah, it really runs the gamut. I've been at this for a long time, again, with my plugs into the mental health community and some really great programs and private practitioners. You know, I really, just over time, have learned to speak their language, and there's just a mutual, you know, just two-way respect. And we're actually, you know, in the works of putting a program together that's going to bring together the best of all worlds. And, you know, it's, the hard thing is we're not seeing a lot of the, you know, what are the big things, the headlines you see, heroin, fentanyl, all that kind of stuff. You know, those are often cases that are too far out of our reach, because, you know, it's really just about keeping these people alive.
Right.
And that's why I'm writing the book, because we're not getting to a lot of those people. So it's primarily alcohol, cocaine, marijuana, sex addiction, internet, I mean, you name it. It's technology addiction is one of the biggest issues, even though it's not an official diagnosis yet.
Right.
You know, we clearly know there's a problem.
Yeah.
Sugar is another one. We're seeing a lot of sugar addicted folks. And then there's obviously spillover with things like that into the eating disorder realm, which is essentially in the bucket of addictive and compulsive behaviors.
Yeah.
So I kind of look at it as that. We look at addictive and compulsive behaviors. When there's a compulsive component to something, that's what we do. Yeah.
And so oftentimes, I guess I would imagine then if people are coming in with a combination of all the different therapies, modalities like that of the neurofeedback you were mentioning too, it's also, even though I guess I would imagine a person that's heavily addicted, there's so much relapses, that's the goal, is to shift the degree of how, like, the potential of them relapsing, right? Or recovering.
Yeah, and that's absolutely. And we're seeing people at all levels. They have to be detoxed when they come to us.
Okay.
But this is also why we're working towards a program that we can accept folks that are in active use, more of a residential style program. We're not a residential program.
Okay.
So therefore people have to be sober for at least a short period of time, at least a couple of weeks, depending on what substance they're using. And then treatment is simply more effective, because when people are actively using, they're not showing up for appointments. They're not, you know, there's a lot of things that can go awry. The good thing is we have the mental health community that we can work with that can help these people stay on track. We're working with, you know, what are called life tutors and other people that are accountability partners, so they can get people to the appointments. Some of the programs themselves will, you know, kind of bus people to our office and have them stay there for the day under watch. And that's really important too, because accountability is huge when people are high risk of relapse. But what's even bigger is you have folks, and we do a lot, you know, this understanding of the mind-body connection, brain-body connection. You know, many people hear this and it seems so esoteric, but this is what we measure and manage every day in practice. When we do balance and vestibular rehab with somebody, or something like the interactive metronome to work with timing mechanisms in the brain, we see attention, impulse control, self-regulation. We see all of these things get better because of the physical work. Because as far as the brain's concerned, they're one and the same.
Right.
And they live in the same parts of the brain. So when we can have an impact on these things and people start getting more connected to their body, that can be scary because so many people are disconnected. So they start having these realizations of what's going on. They start having these, you know, what's termed a healing crisis. Most, you know, people in the mental health world, they strive to get into that healing crisis with somebody so effective therapy can be done. But when you have somebody so disconnected between the brain and the body, there's no chance of getting to that healing crisis. You're just, you know, beating your head against the wall trying to create change. So what we do allows the folks in the mental health community, and we've been told this time again, to have more effective work done on that part. So yeah, it's just so important for that understanding of this brain-body connection, and the work functional neurologists do can have a massive impact. But there's also a danger to that, because if somebody's not under active counseling or therapy, you know, they can go off the deep end. They can go back to whatever it was. They can go back to that substance or that behavior and get in a lot of trouble. We've seen it.
Yeah. Do you mind, just since we're talking about the addiction realm, what is one story that jumps out to you that just, you know, really just affirms what you're doing and why you're supporting people in the addiction world? Is there?
Oh man, there's just there's so many. There really are so many. You know, we have on the higher spectrum, you have people that have been addicted their entire lives, and they're very successful in their careers, and you know, maybe not so much with their families. They've, you know, achieved great heights, but they have always known there's something wrong, and they're heading into their 50s and 60s and 70s realizing they've destroyed their bodies. They want to live higher quality of life in their later years. Their brains are slipping. You know, I love those cases because you're giving people back that quality of life in the limited years they have left. But I think at the end of the day, it's getting to the younger ones that now have a full life ahead of them that very likely was not going to be there had they not addressed these things. And you know, we had some extreme cases where, and there's always underlying components of childhood traumas and physical traumas, brain injuries, you name it. There's a lot of crossover between brain injury and addiction. But one case in particular, a young male who had actually come to the States from out of the country. He was from Asia, and came to the States to a residential treatment program, and they got him into our program. And he was, you know, fairly psychotic at the time. He was injuring, you know, causing harm to animals and things like that. His addictions had gotten so out of control. You know, very self-destructive himself, and really was kind of written off by a lot of people. They just didn't think he was going to be able to get anywhere, that he was going to be institutionalized, and that was it, if not winding up dead himself. So we worked with him fairly extended period of time. We worked with him for about 40 days because it was so extreme. And you know, I'm happy to say, you know, without all the details of the treatment and everything, this is now 2.5 years later, and he's already gone through college, got his associate's degree. He's teaching, just got married, and has a kid. And again, this is somebody who was largely written off, even by the people that have tremendous hope that were caring for him, because all signs were pointing to very bad things. So you know, that one always stands out with me, just knowing that that life has, you know, was gotten back. But not only that, now there's more life because that individual took care of themselves, and what this individual can give to the world based on his experience, you know, is I couldn't ask for anything better.
Yeah, that's powerful. I mean, we don't think about, you know, oftentimes, you know, when I used to hear about addictions, the first thing I think about is just like these major drug addicts, but it's not. It could be our neighbors. It could be someone who's struggling with a disconnect that is, you know, it's not outwardly, but just even our own personal, like, we sometimes, I mean, realistically, I can abuse a certain, like, even technology, like you're saying, right? And where it's something that's so widely used and we don't think about it. But then how does that impact the relationships? How does that impact our behavior? How does that impact our life and how we interact with everybody else and future generations? Again, it ties back down to what we do now affects every, future generations, and the difference you're making in taking care of these patients, like the one that you had just shared, is powerful.
Well, thank you. Thank you.
Mm-hmm.
Yeah, and I want to add to that too, because you touched on something initially when you started. There's just an incredible, even from health providers, this amazes me, there's an incredible lack of empathy for the addicted community, for substance users, for, there's been a lot of change in terms to really help build in kind of empathy for this population, because people still say, oh, they just make bad choices, it's on them. Why give them Narcan? Because they're just making bad choices. Well, the fact is, you may make a bad choice one time, and that bad choice leads to, your frontal brain being hijacked to the point you can't make decisions anymore. You can't inhibit impulses. You can't, socialize. You can't do all these things you need to do as a human. So you go back to that drug for that, for that comfort. And there's a point where, there's Mark Lewis. If you ever read the book Biology of Desire, it's a phenomenal book, and what it does is it really gets to the root of that this is not about bad choices. This is not about a genetic predisposition. This is about somebody that did something 1 or 2 or 3 times and is now stuck in it because their frontal brain, their human brain, cannot make choices to get them out of it. So empathy is entirely necessary in understanding these are human beings. Yes, they're doing bad things, but their brain is not there to stop them from doing those bad things. And that's what I was talking about before. When they start getting a bit more connected, so to speak, all heck can break loose, because now they're so confused. Now they've got the angel and the devil on their shoulders going back and forth when they only had the devil before. Right. So, pretty interesting concept, but, empathy is huge. I want to stress that with the audience.
Yeah, absolutely. And I'm curious, you mentioned, it could just take 1 or 2 times to hijack the brain. Is it possible? What if, and it's more, would a person be more vulnerable if they're, and it comes back to, we're not just limited by our genetics, but our environment too, but also our state of health to begin with. So, if we weren't taking preventative measures, obviously, I would imagine that if there was a disconnect to begin with then
absolutely.
Does that make the degree of being hijacked higher, more in bigger influence than if your brain was a little bit healthier and more balanced?
Yeah, and that could be many different ways. It could be pre-existing learning and behavioral issues, ADHD, OCD, PTSD, autism. The rates of addiction in older autistic individuals now, because there are so many with the diagnoses increasing over the years. Now we're seeing a lot of these in their 20s, a lot of these individuals in their 20s, that they're doing anything they can just to feel normal, right? They know there's something not right in their brains. I won't say wrong, there's something not right in their brains, and they want to do things to help them be able to talk to people easier, to not feel as anxious. So yeah, certainly brains are hijacked through learning behavioral issues, through traumatic brain injuries, concussions, you name it. Absolutely, which only just perpetuates the pre-existing problems and makes that that nut much tougher to crack, so to speak. But that understanding is absolutely huge. Yeah.
Okay. I'm curious, how did you get into the addiction world? Like, what led you to helping these people?
Yeah, I had a real good friend who is what they call an education coordinator. Basically, these are the people in the addictions community that figure out where people need to be. So if somebody calls an addiction facility and says, "Hey, I've got this problem," what level of use are they at? How bad is it? How critical? Do they need to be in a hospital, a residential treatment program, intensive outpatient program, sober living, or do they just need counseling? That's what that person does. And I learned a lot about that through just hanging out with him a lot. And I said, man, I'm seeing this stuff all the time anyway. We need to do something. So we got together and we started doing talks for the addiction recovery community here locally, then started going to conferences and things like that. And I really understood we had such a tremendous place in this addiction treatment world. And again, I'll say I'm not a mental health provider. We just help augment that recovery process. And I'll also talk about the word recovery if we got a couple minutes. I'm not a big fan of that word. It's again, semantics, but it's really important to understand people are not going back to the way they were ever after addiction. So recovery is a bit challenging. But working with him, I just got to meet so many people in this world. And once they would kind of loosen up and get past the understanding of, what we did as functional neurologists, and even kind of breaking away from the chiropractic underpinnings, because people tend to get stuck on back pain, neck pain. They don't realize it's going to do anything for addiction, but clearly it does, even if just looking at it from a pain perspective. But I think we just saw equal value in what we did, and just kept talking to people, kept doing seminars, and it went from this thing. I remember these first meetings I'd go to, I'd walk in the room, and people would be looking at me out of the corner of their eye, and they're like, "You're not a psychologist, you're not a social worker." And then months and years later, and I was like, "Oh, you're the brain dude, right?" It's so they I really, it's understanding how each person ticks. Whether you're working with orthopedists, neurologists, mental health providers, you have to understand their language, they have to understand yours. So I'm all about, you talked about Dr. Malillo. I spent 5 years with Dr. Malillo in New York way back, and I learned how to talk to other healthcare providers and learn their language and have them respect our language. So I never really got into that place where I was defending what I do, because it was a mutual respect always, and that's where we kind of got into the mental health world.
That's really awesome.
Yeah. So what word would you use outside if recovery's not, and I agree with you, recovery is misleading in a sense. It just takes you to the original place to recover to that place,
right.
But there's no change, and that's what led you there. What would you rather use? What would be a better term?
Yeah, and this may just be a personal thing, but I know other people are talking about this. We're always wanting to reword things and change, and it's, some is about being politically correct. For example, the word addict is just not used anymore. It's, substance user.
Mm-hmm.
There are some political correct, issues there.
Yeah.
But even people who are addicted will use the word addict. So these things are still widely used.
Mm-hmm.
But I think with recovery, you break a bone, you heal it, that bone is now recovered, right?
Right.
It goes back to the way it was.
Yeah.
So, and it also indicates that something was broken, right? So when you look, there's some really cool studies. Public Library of Science in 2012, I think it was, there was an article about people who had sustained abstinence for 6 weeks or greater were showing increased volume in areas like the anterior cingulate cortex, dorsolateral prefrontal cortex, so these highly human parts of our brain. But they were showing increases in the thickness of these areas of the brain that rivaled pre-usage size. So their brains were actually stronger and better and badder after the fact, because sustained abstinence takes a lot of hard work, a lot of willpower, a lot of mental exercise.
Mm-hmm.
So it's actually transcending, going above and beyond. It's not recovery. It's people are better when people successfully recover. They're better than they ever were for the most part.
Yeah, that's really
unless they've done a lot of damage, right?
Yeah,
Right.
absolutely. Yeah.
So talk to us a little bit about the book that you're writing.
Yeah, it's a this book was designed. It's taken many detours along the way, but it's essentially a survival guide, a handbook, because there are so many people, particularly with millennial and Gen Z. I'll never blanket a population, but the fact is, these two populations in particular are having a real hard time, jiving with more conventional approaches that have been around for a long time.
Mm-hmm.
When you look at, and this is, I don't ever want to say, I'm against 12-step or anything like that, because these programs have saved millions and millions of lives. But you have generational conflicts now where people aren't necessarily buying into these, mentally buying into these lines of therapy. So they're checking off the boxes, they're getting out, and then they're going back to doing what they did. So there needs to be brain-based intervention, because simply going through the motions of a program or steps of a program is just not cutting it. Hence the rise in death rates, the recovery and relapse rates. All of it is just off the charts now. People are largely not getting better. This program's doing amazing things and keeping people alive, but the true recovery is much worse than it used to be. So we need to have resources for people that, number one, are not going to seek care on their own. We always recommend people seek care, particularly if they're, if there's critical mass and lives in danger, etc. But they need resources to start getting their lives on track, eating better, sleeping better, thinking better, moving better. but also building in brain-based applications, simple things people can do, starting out with breathing and just, eating a little bit better, moving a little bit better, then starting to balance brain functions. So we're doing it's a 6-week program built into a book. The program is going to be bookended by the understandings or underpinnings of addiction, and then the end of the book will be more higher level applications people can seek if need be, but always with the understanding we want people to be safe. This is not the end all be all, but it's going to help people that are struggling, that will not seek treatment. It's going to help programs that are looking for options to give their residents. It's going to help private practice social workers and providers give a tool to their clients and their patients that will hopefully help them just sustain abstinence. And I'll talk just real briefly. My personal situation: I had a horrible motorcycle wreck in 1995. Spent a month and a half of my life in the hospital. I had a morphine, basically heroin pump. Whenever I felt that pain, I just got my zap, and within 2 to 3 weeks, I was fully addicted, and it was not a good feeling. But I had injuries that were so bad that I was in just constant chronic pain, that when it ran out, it was incredible. I was in my early stages of graduate schooling at the time, so I had incredible purpose and drive to get out of that hospital bed. So there's a point I told them, get that pump out of my room, I'm going to deal with the pain, and I dealt with the pain. But it was the purpose and the drive that got me away from what potentially could have killed me, because I would have been a full-blown opiate user leaving that hospital, because I could have gotten any drug I wanted, and I was already addicted. So I had to break free, and the reason I did was because of that drive and desire, in my opinion. There's a lot of experts now understanding that. So we're building into the book, too, people creating purpose in their life, because most addicted folks don't have much purpose. They're doing things, and they're just living these cycles of life without anything bigger out there that they're reaching for. So things like Dr. Malillo teaches, you've got to have drive, purpose, passion. No matter how small it is, there has to be something out there. So that's another aspect of the book.
Yeah, that's a powerful key, I feel like, because then it ties into the not just the physical but also the mental emotional component of questioning our existence, really. And
right.
And I think I've noticed myself when I go through things and my habits are not as great, is really when I lose that sense of what's my outcome, what am I trying to accomplish, or what's my purpose, and everything. And
right.
So I can imagine for someone who's going through something so much bigger, needing to actually go through that self-discovery
right.
is so necessary. And I also think that it's also necessary to partner with people who come from that aspect where, I guess, from the functional neurology world, even medicine practice is kind of more alternative, complementary, that it's also necessary to also explore those areas as well too. I think from something like acupuncture perhaps, or some other type of bioenergetic work. Well, do you see that as something still being able to complement the things that you're doing or what you're subscribing, or is that necessary, do you feel like, in a world of addictions?
Yeah, I do. There's a time and a place for everything. I think what happens, and again, this is not to go after programs that are out there, but the vast majority of recovery programs out there now are built around models that are very old and somewhat antiquated. Yeah. And what happens is, around that model, they're building in, let's put in some acupuncture, we'll do some equine therapy, we'll do some things, but the basis of the program is still the same. Right. So yes, there can be some effectiveness, but I don't think it's being utilized to its full capacity. With the actual backbone of the program being, let's rehabilitate this brain. Yeah. Let's get this brain working better. Yeah. They're trying, but it's not the norm in the recovery world. So it's very hard to break away from models that have been set for so long. But absolutely, anything that can be done to help people, decrease anxieties, decrease pain, any of these things will impact someone's quality of life for sure, and allow for that, them to be able to have the wherewithal to develop some level of purpose. And particularly now, we're in this pandemic situation. I mean, think about a 20-something restaurant worker who's been sitting home for 6 months now. It's already a high-risk business to begin with. Right. That's all they're doing now, is just sitting home and drinking and doing things that are naturally going to keep them in these cycles. So we need it now more than ever because purpose and drive and passion is really at an all-time low because of the circumstances we're in.
Yeah. Well, personally, it's something that I'd really like to, still being really early in our career, and just really, this is new for me, for both Dr. Sam and me. I personally do have an interest in supporting people who are going through addictions, and I'm still really new to that and honestly really shy about it, because I don't, I feel like just going one step at a time and studying, but what are some, I imagine there are other practitioners that have this ambition of wanting to pursue the route that you have and really taking it to that next level and being able to work with the recovery world, which sounds like it's still very outdated or not, it's still very traditional. What words of wisdom would you give to new, practitioners, new, even if it's mental health or counselors, what ways can we step forward and maybe start to change the direction, or for us too, like how can we start to grow our own personal expertise behind this?
That's such a huge question, and I appreciate it. The key is just learning everything you possibly can, because there's so much. I mean, even just from the basics of going in and understanding, what is the prevailing definition of addiction, right? It's the prevailing definition is it's a disease of the brain.
Right.
So understanding that, but also understanding the people that tout that or stand behind or develop that understanding are fully open to brain-based applications. They understand and respect and embrace neuroplasticity. It just a definition of something is very hard to change. So the thinking is way ahead of the actual, where things are at. But it's really just, putting, where the rubber meets the road, so to speak. We've just got to act. We've just got to do, and do it safely too. I don't want anybody thinking for a moment, and I will, as long as I've been at this, I will never say we're treating addiction or curing addiction, because that is just not true. We're treating the underlying brain dysfunction, the brain networking issues, the attentional deficits, impulse control issues, which all equal addiction. So really just connecting the dots is critically important. So you're going through courses and all, I know you're working with primitive reflexes and how the brain develops based on one's ability to integrate these primitive reflexes. Well, that's a critically important understanding of why someone may get addicted by the time they turn 12, 13, 14 years old. And clearly, early intervention is key. So, it's just really connecting the dots and not just trying to treat the symptom of addiction, because even with complementary and alternative medicine, I see over time, because I've been at this a while, a lot of it is becoming sign and symptom based, right? You're a back pain, you're a neck pain, you're a headache, you're an addiction, you're whatever, you're a TBI or a symptom of a TBI. But the fact is, we've got to look at the big picture, bird's eye view, and take information from the EEG arena and the mental health arena and the functional neurology arena and put it all together and say, how can we best serve this person in front of us from a true, the word's been overused, but a true holistic point of view, really holistic and not sign and symptom based. So that's my word of advice, is just not attacking it saying I want to treat addictions, but really understanding the neural basis of it.
Yeah, that's wise. Thank you. Appreciate that. And I noticed that you have a laser behind you, the Avant laser, which is, something we're
I've got them floating around all over the place.
I know every doctor who has shed light may have like 8 or 10 of them around. So out of curiosity, how many shed light lasers do you have in your office?
I've got a couple here, one at home. Yeah, we've got it's just a tremendous compliment to our stable of services. It really is. And I, like you said before, these guys don't pay me to say it, but they are, the people behind the company are just the best. When you talk about customer service, collaboration, unbelievable folks. So, if you don't have one, absolutely get one. It's been, we got our first one a couple of years ago, and it was one of the best additions. And we don't add things lightly to our practice. I kicked tires for a long time before I purchased something. So, it was, and once I did, I said, why did I wait so long? But, phenomenal tool. And there's some really cool stuff coming up too with low-level laser and addiction too. So as well as hyperbaric, some things we're going to be getting into. So there's some really cool applications in the functional neurology world that are research backed for dealing with addictive and compulsive behaviors.
So fascinating. That's awesome. That's great.
Yeah, and much needed, because I mean, no one knows what's going to come out of this whole pandemic. We all have guesses. I think we're going to see a huge rise in addiction. Obviously, mental health is going to be a big problem going forward too. And yeah, having the necessary tools and training to address these things is going to be critically important. Like as you said, and again, that word being overused, but really taking care of the whole person, not the signs and symptoms that's really just being pushed everywhere.
Right. Absolutely.
So we have 5 minutes left. I would love to touch a little bit on cognitive decline, and because that's a scary thing, especially for people, I think, even in my age, 30s, and seeing like, hey man, I'm not the same sharp tack I was at 21. So what are you doing to help people stay on the razor's edge and keep them sharp, well into their 60s and 70s?
Right, yeah, it's, it comes back to this brain-body connection. When we do a cognitive test on somebody and we see, their database match scores, in executive function, cognitive flexibility, aspects of memory in the, 5th or 10th percentile compared to their peers, really, really low scores. Yeah. And these are people that are still functioning really quite well. What do we do then? We go ahead and we measure their balance systems. We measure their eye movement systems. We measure, look at complex motor skills, motor timing mechanisms. And almost always there's going to be a parallel deficit. So what we do is we treat it as we would almost any other case, and we create the neurological efficiencies that will allow the same parts of the brain that move the body to mentally work, cognitively work better. And I've been at this long enough, and we have so much data, mountains of data. And the fact is now we can say when somebody's come through in mild cognitive impairment, we're not talking full-blown dementia or Alzheimer's, but mild cognitive impairment, 10-day programs, we're showing now average 30% gains in cognitive flexibility, executive function, simple attention, and a couple of other areas. So 30%, and that's really mostly through physical means. We're certainly supporting metabolically, but it's largely the physical changes, improvements in the balance system that dictate the health of our large human brain that are creating these changes. And that's what people see and feel, and it can happen quite rapidly. It's really devastating to see when people are in the throes of a true neurodegenerative disorder, and then, there are certainly things we can do to hopefully slow down and stave off, but the decline can be quite rapid. I'm on the board of advisors for the Dementia Society of America, and I love organizations like this because they're looking for proactive methods to help keep people healthier in the here and now, and as opposed to the search for the elusive cure, which dementia is such broad territory, a cure will likely never happen. So art therapies, music therapies, physical therapies, etc. These things are critical for keeping people online. When their balance gets better, their brain gets better.
Fantastic. So what advice would you give to people at home if they can't obviously come in and see you, but what are some tips they can do at home or in their own life to keep them sharp?
Yeah, I don't know if you ever saw a video, it's called Never Leave the Playground on YouTube. This guy had done these videos around his house, and he would have buckets, and he'd pick up things with his feet and drop them in the buckets, and he had little slack lines. I'm not saying people with balance problems should be getting on slack lines or anything like that, so there's my disclaimer. But, just doing things proactively, particularly if they're already having breakdowns in balance. Tai Chi, yoga, dance classes, things like that, because not only are they going to help with balance, but they're also purposeful movement, so they're going to have a tremendous cognitive impact. Shooting a basketball, the object get the ball in the hoop, there's not a whole heck of a lot of cognitive engagement. It's a skill, it's a motor skill. But when you're doing a tango or when you're doing a Tai Chi form, there's a huge cognitive component to that, and this has been measured time and time again. The Movement and Cognition Conference that I go to every year that you may know about, you have researchers from across the globe talking about this stuff. So getting people to do purposeful movement, challenging their balance systems, getting off the couch, getting the remote out of their hands, getting outside, outside on uneven surfaces because our flat surfaces have destroyed our brains. It's all of the above. And again, sleeping right, eating right, thinking right. A brain is never going to get better if it's not sleeping.
Very true. Fantastic. All right. Well, that is wrapping up our time today. Dr. Lynn, do you have one more question for him, or?
I think, you know, I've gotten a lot of great information today, and it's
I know.
inspiring too, honestly. So it's like, oh, where we can start to work towards too, and continue to work towards, honestly.
Yeah.
And so
That's probably always the funnest part about doing the radio show, is connecting again with docs like you, Dr. Michael, and again seeing, hey, what does 20 years of excellence and commitment look like? And you know, here it is on the screen right here.
Yep. And it's very affirming for us too that we're on the right path.
Exactly.
It's a great community.
Absolutely, you are. Keep up the great work. You all are doing phenomenal job here.
Awesome.
Thank you so much. And thank you all for tuning in today. Again, hope you learned a lot, again, from the ultra smart Dr. Michael Trayford. If you are a person who is, again, suffering from any kinds of, you know, addictions, traumatic brain injury, cognitive decline, things we talked about, then we implore you to reach out to him if you're in that area looking for help. And Dr. Lynn, can you lead us out with the question we always ask?
Oh, yes. Tell me, what is it you plan to do with your one wild and precious life? Thank you for joining us.
We'll see you in 2 weeks.
See you in 2 weeks.